Team BELOGRAD, and we present you the episode number 6 of BG Dental Cases video tutorials that are dedicated to clinical cases review. This time we will share with you, we'll present to you 2 cases actually, because they are relatively the same. Very interesting cases, very lateral thinking cases, and the cases that we call combined or hybrid restorations. The first case is when I removed, you know, there is a metal, like a hammered metal, it was metal bridge actually, hammered metal bridge, which is old, very old-fashioned dentistry in Ukraine and post-Soviet countries, by the way. A very thin metal crowns that nobody uses nowadays except in the villages in post-Soviet countries sometimes. But anyways, it was metal bridge. I removed metal bridge, and it was super surprised that we had enamel of all over this tooth. But the problem was that we also had this caries defect here, the cervical caries defect here. Unfortunately, I missed to take initial picture once I removed this PFM bridge, and also I missed to take a picture of PFM bridge, not PFM, sorry, this metal bridge. But anyways, I got a problem actually when I saw this tooth, when I removed caries defect, when I removed cement and everything. I was pretty confused in terms of the way to select to treat that tooth afterwards. So basically I was in front of dilemma to do classic approach or to do something in terms of new or lateral thinking approach. In other words, what I was thinking about, the first classic approach told me that in this case, once you removed caries defect, here at the cervical area, you have apical intact tooth structure that can be used as a reference point for the cervical finish line. In this case, I would have to prep this tooth slightly more. I have to move this preparation more apically. I would have to respect also tapered preparation, conicity of preparation, and in this case I realized that tooth in the area of cervical lesion here is pretty thin, and here the tooth was pretty thick. So basically, if I would go that deep, and considering the necessity to do a tapered or conical preparation to get proper pathway of insertion for the crown, and also a big bulbosity here, respecting 2 planes of crown preparation, I would compromise even vitality of this tooth, because my preparation will be super aggressive from all the way around. So I would start to think, okay, what I can do in this case. I have to treat this caries defect. The question that I asked to myself was what I think about this caries defect class 3. For example, if I will take away the necessity to do crown, let's say patient comes with just caries defect, no crown needed, no veneer, no overlay, nothing, just simple class 5 caries defect. In this case, I would put filling, definitely, and following proper bonding protocol, following proper layering process, we can get a really long-term survival rates for direct composite restorations, even in these class 5 lesions. So in that case, let me go back here to my previous slide. In that case, actually, I decided to do combined restoration, crown as crown and composite filling as composite filling. Actually, here you can already see that I started my preparation in enamel. Here you can see my initial finish line that I did in bulbosity area. So in that case, the conicity is okay, everything is perfect, and I keep enamel. I keep everywhere enamel, and that part of the tooth will be restored with direct composite material. So that's it. So we actually did this type of dentistry. Crown later on will be bonded to enamel here, okay, and the rest was done with direct composite restoration, like a class 5. And you can see from occlusal surface, I will give you another perspective. From the occlusal surface, you'll be able to see the true minimal invasive approach for that type of cases. These are the steps of the sequence of direct composite restoration. In that case, I use total edge technique, so I edge dentine, I edge some enamel, then I bond, then I place some flowable, then I make some packable composite layering, finishing, polishing, and this is the result. You can see all enamel around preserved, pretty thin preparation. And considering the fact that we will be using metal-free ceramic restoration, which is Emax crown, and we will bond Emax crown to enamel with a good surface fit, this crown can be thin. It is against the rules. What I would like to mention, it is against the rules that is written in instructions by the Ivoclar to the Emax material. As far as I know, that they say that you have to give at least 1 millimeter. But just imagine when you have to prep that tooth for 1 millimeter axial and all around reduction, there will be no enamel and there will be a big question regarding the vitality of this tooth. And I'm not trying to convince you that this is the best option ever in dentistry, because if something will be wrong with your restorations, you will say why I didn't follow the instructions, and you will be right. But again, my knowledge and my skills and my decision taking is based on clinical experience, not just by my clinical experience, because if I will be saying that I do like dentistry like this, it's just a subjective point of view, let's say. But I know a lot of clinical cases similar like this one from people that are like leaders in dentistry. Mauro Frediani, Didier Dici, Pascal Manier. They show thin ceramic restorations bonded to enamel. They also have some cases like a hybrid restoration, where they bond ceramic to composite with the long-term survival rates, with a clinical experience more than 15 years, the follow-ups more than 15 years, which is really amazing. So in that case, bonding process was with rubber dam as well. You can see the thickness of the crown. It's against the rule completely, but I would like to mention one thing. The thickness of the crown that is written in instruction includes dental mistakes that we sometimes would do, like adhesive mistakes, preparation mistakes, thick spacer, etc. So if material with 1 millimeter, material is strong itself, it will survive, it will resist some procedural mistakes by the thickness. That is the issue of thickness of materials. But if you respect, preparation is smooth, fit is good, enamel is preserved, it may work even with that thickness that you saw in previous slide. So this is the final result of the crown that was bonded, and I would like to share with you another case which is pretty similar, but case is slightly more difficult because there is not caries defect. Here you can see abfraction, okay? Which means these teeth, they have also lateral occlusal loads, and if you would just do that type of restoration, let's say I would combine ceramic and composite, composite may not survive because the abfraction in that case is caused by poor occlusion, okay? This case, this is the part of full mouth reconstruction case. In this case, we redesign occlusion for all patients' teeth, and we reduced lateral occlusal loads for that teeth. And the problem that I got in this case is that patient wanted to get her teeth more whiter. So color change was the number one issue, and another issue was occlusion. And considering the pathway of insertion of that type of restorations where you have to cover all occlusal surface and also you have to cover buccal surface, the pathway of insertion is not like veneer, not completely horizontal. The pathway of insertion is more vertical. So in that case, if you have pathway construction with a vertical pathway of insertion, you have to deal with the bulbosity. You have to prep bulbosity area, and in that cases you may compromise a lot of enamel lost. So one more time, in this case we decided to do combined restoration. I asked myself again the same question, what do I think about class 5 restoration, and I decided to do that type of combination. One very important thing that I would like to share with you as well. To be able to make that type of decisions, you also have to evaluate type of patient's smile. So basically, we have three types of smile. We have high smile, when patient speaks, when patient smiles, you can see gum level. You have, let's say, moderate smile, when you can see only cervical area, but there is no gum exposure. And you have low smile, which is patient smiles, patient speaks, screams, yells, etc., and you cannot see anything except patient's teeth. So in that case, you are pretty safe. This clinical situation was type 3, so basically her smile was not that high. So basically, when she was speaking and smiling, we were not able to see cervical areas. It's good information for us because we are not in super aesthetic zone, by the way. And another thing that may happen also, you have to take this in your mind. You have to think about this in your mind. For example, here is my finish lines, by the way, that are in enamel. But for example, I will put composite here, okay, and in some time, there may be some discoloration here between composite and ceramic. Sometimes, like a discoloration brown or some black or some whatever. Since there is not very static zone, it is acceptable. Anyway, but anyways, this kind of composite discoloration is manageable by hygiene and just process of repolishing. But you have to give these options to your patient and to explain that in some time composite may discolorate, and we know how to fix this problem in most easiest way. So your patient will be confident that if there will be any discoloration, you know how to fix this problem. This is the sequence of restoration, and again, important, in this case, finish lines were in enamel. So ceramic will be bonded completely to enamel. It will be bonded not to composite, it will be bonded to enamel, okay? Let's go. Here you can see from occlusal view the amount of preparation for that premolar. Pretty super conservative preparation. Everything is in enamel. There is some composite there because of the caries defect, but anyways, pretty conservative. A lot of tons of enamel was preserved. Okay, and when we were bonding our ceramic restorations, what was also interesting, we didn't need to do an aggressive isolation with the clamps or whatever, because all our finish lines are supragingival, and we can just do normal isolation, as you can see here on that slide, and every single margin is already exposed, and we can just bond our ceramic restoration with no time spending doing aggressive isolation. Let me show you the final result of this case. This is actually before cementation. We just did some floss ties just to move a rubber dam slightly down. All teeth of this patient were restored one more time because this is a full mouth reconstruction. This is the final result after bonding, and here you can see lower teeth of this patient after 3 years. Occlusion is stable, everything is okay. Dental hygiene is requested every single half a year, and patient and dentist both are happy. Okay, so this was our another case presentations. I would like to ask you one more time to write in your comments topics that you are interested us to cover: endodontics, post-endodontic rehabilitation, veneers, aesthetic dentistry, smile makeovers, crowns, veneers, overlays, what else? Composite restorations, direct, indirect, etc., etc. Everything I can share with you, I will be more than happy to do. Another question that some people ask us in comments is that what kind of other type of education we offer, and I would like to say that our BG Academy is doing, we do a lot of hands-on courses. We even have slogan. Our slogan is BELOGRAD Academy, we are hands-on. So our module courses are 100% hands-on. So basically we have no theory, which is unique formula that only we have, and I can ensure you that if you are really looking forward to get a real practical course, we can offer this, because everything that you have in your mind, all questions that you have in your mind are covered during practical sessions. 100% hands-on time, and your skills will be enhanced in very short period of time. We have different modules. You can see our program in our webpage, which is en.belograd.com. Actually, you can see a link for our webpage on under this video. So that's it. Don't forget to subscribe our YouTube channel. Don't forget to switch on notifications, because a lot of interesting content is coming very soon. So keep in touch, and see you very soon. Bye bye.